Republicans don't want the American people to see the bill. They are so ashamed of their health care plan, they want to pass it in the dead of night, no hearings, no amendments, rush it through. It's not a bill they're proud of. If they were proud of the bill, they'd say, let's debate it. They're ashamed of the bill.
The Senate GOP's secret process for drafting its health care bill might be about to get even more outrageous. My next guest, who is deeply enmeshed in the health care fight, has been told that Majority Leader Mitch McConnell may use a legislative maneuver that will virtually eliminate debate once the bill is finally made public. Joining me now, Andy Slavitt, who under President Obama ran Medicare and Medicaid and administered the Affordable Care Act. And Andy, you've been someone who's been very plugged into what's going on the Hill around this. You have a lot of connections to folks that are in healthcare policy. And you tweeted something the other day basically being that McConnell is considering a procedure that would essentially allow them to file an empty bill, let a huge amount of the time for debate go by, and then replace in the full bill text and try to pass it in a few hours. Do I have that right?
You have that right, Chris. I mean, first of all, no one really knows what McConnell is going to do. No one knows what's in the text of the bill. No one's entirely clear what his process is, and there's plenty of misdirection. But what we're hearing is that the absolute minimum that he can do normally is a 20-hour debate, but that with a special process, they can put in a substitute bill, say the bill that passed the House, leave the Democrats to only debate that bill, and then substitute in the new Senate bill over at the very last hour.
Meaning like just an hour before? I mean, honestly, what you're saying is that the procedural mechanism might exist, if he's willing to be totally maximalist about it, to essentially have the Senate vote on a bill that's been public for an hour or two.
Well, what they would do is they would make the last amendment something called a substitute amendment. And the substitute amendment would basically say, everything that we've been debating, we're now going to substitute a new bill in place of the bill that we've been debating, and that's the bill that's going to get voted on.
So this process is unlike anything I've ever seen. I think it's unlike anything you've ever seen. But there there is pressure that's being brought to bear. One of the key figures in this, it seems to me, is Dean Heller, who's a Republican senator from Nevada. He's the only Republican who was in Hillary Clinton's state who's up in 2018. And today I thought something interesting happened. I want to get your feedback on it. A letter was sent from a number of governors, including Governor Kasich of Ohio, Steve Bullock of Montana, Sandoval of Nevada, Charlie Baker, I believe, of Massachusetts is on there, basically objecting to the House bill and laying out some principles. That puts some real pressure on Heller, doesn't it?
Yeah. What this letter says, and it's really very interesting, what the letter says is that this bill, in effect, is a $1.1 trillion takeover of from the federal government of the states. Ironic, given all the talk about state versus federal, and a pullback of community resources at the federal level through the major shutdown of Medicaid. And what they're basically saying is, look, take Medicaid off the table, focus on the things that need to be improved with the exchanges, and you will have our bipartisan support. And I think as governors, they speak for many other governors, and I think by extension, the senators there ought to be paying attention.
But of course, the Medicaid is where the money is. I mean, the entire distributional ledger effect of the House bill is you want to get rid of all those taxes on the rich that were part of Obamacare, $800 billion. To make up for it, the only place to go and get the money out of the system is in Medicaid, basically.
That's right. That's right. You got to, and the math works this way. If you want to pass a tax cut for millionaires, medical device companies, pharmaceutical companies, and health insurance companies, you've got to take a significant amount of health care away from the bottom 40% of income earners just to pass a $55,000 tax cut for millionaires. So it's extraordinarily redistributional math.
And it turns out that that's not something that is easy to defend. The House had a hard time. It was killed when it was public. They then sort of did a secret sneak attack and got it passed. And now the Senate is basically trying the same thing, right?